Welcome all to Govt Nursing Officer exam preparation videos. This video is the mock test answer explanation with rational video. Each question is added with analysis of options and with memory tips. As the fetal blood vessel lying over the internal OS in front of the presenting part. Option A, cord prolapse. Option B, cord presentation. Option C, occult cord prolapse, and option D, vasa previa. The right answer here is option D, vasa previa. Let us see the difference between vasa previa and umbilical cord prolapse. Vasa previa is a condition where unprotected fetal blood vessels cross or run near the internal opening of the uterus. Here the blood vessels are unprotected, not supported by the placenta or umbilical cord. But here in umbilical cord prolapse, it is umbilical cord comes out of the uterus with or before the presenting part of the body. You can see here the umbilical cord as a wall is coming out. Here vasa previa, loose fetal blood vessels unsupported by the placenta is coming out. Next question. When administering enema to a patient, how far the nurse should insert the tubing into the rectum? The option A, 1 to 2 inches, option B, 2 to 3 inches, option C, 3 to 4 inches, and option D, 4 to 5 inches. The most appropriate answer here will be option C, 3 to 4 inches. Here you can see the difference between depth in adult and children for enema administration. Infants 1 to 1.5 inches, older child 2 to 3 inches, and adult 3 to 4 inches in generally for enema administration. Next question is, facial palsy is also known as option A, Erb's palsy, option B, Klumpke's palsy, option C, Bell's palsy, option D, brachial palsy. Here the option is option C, Bell's palsy is the right answer. Let us see the features of Bell's palsy. It is a condition characterized by sudden weakness or paralysis of the muscles on one side of the face, resulting from dysfunction of the facial nerves. We can see the features here in Bell's palsy. Drooping eyebrow, drooping eyelid, here the facial nerves, and drooping corner of the mouth. So this is the features of Bell's palsy. On the other hand, the Erb's palsy and Klumpke palsy. Erb's palsy, the condition causes weakness or paralysis of the arm. Klumpke palsy is a rare birth injury that causes weakness or paralysis in the hand and forearm. It is a form of brachial plexus palsy. We can see the memory tips here. Bell face, Erb, Klumpke hand. Next question. All the below could be sign of systematic infection except option A, fever, option B, vomiting, option C, fatigue and tachycardia, option D, lymph node enlargement. Here the right answer will be, or more appropriate answer will be, option B, vomiting. Let us see the signs of systematic or systemic infection, that is fever, tachycardia, inflamed lymph nodes, hypotension and confusion. Vomiting can be associated with this but not a specific symptom of this systematic infection. So the most appropriate answer will be here, vomiting. Next question. An individual expressing his failures and difficulties by blaming others is known as option A, repression, option B, projection, option C, sublimation, option D, denial. So here which defense mechanism is working? The right option is option B, projection. Let us see the details of this defense mechanism. Projection is the process of displacing one's feeling into a different person or animal or object. For example, if a husband is having an affair with another girl, then he is just covering it up or defending it up by alleging his wife is having a relation with someone else. So this is just displacing one's feeling or one's emotion to another person. Repression is a defense mechanism that involves blocking or withholding unpleasant thoughts or feeling from conscious awareness. So here the person will be just suppressing it, like he don't want to remember the unpleasant past events. So he is just repressing it or blocking it or withholding it. Sublimation is a defense mechanism that redirect unacceptable impulses into socially acceptable behavior. For example, if a person with a high temper and high energy, he will be just channeling or engaging in his sports or social activities. So he's channeling his unacceptable behavior to socially acceptable behavior like sports or martial arts. Other example is one person who is very sad is just engaging in painting. So this kind of channeling to acceptable behavior is seen in sublimation. Denial, everyone knows, it is a defense mechanism where someone refuses to acknowledge the painful fact or realities. Here the person denies or fail to accept or not ready to accept the realities. That is denial. And displacement is another related defense mechanism in which the person is displacing his emotion to a less threatened object. For example, a person get a very nice scold from or very nice shouting from a boss. He can't react to his boss, but he just when he come back to home, he will just blame his children to channel this to a less threatened object. So this is displacement. So be careful about all these defense mechanisms. Next question. The example of health promotion is option A, immunization, option B, medicine administration, option C, stop cigarette smoking, option D, all the above. Here only one thing is just health promotion activity, that is stop cigarette smoking. Let us see the other activities. Vaccination is a primary prevention activity. It will prevent the disease to happen. That is a primary prevention. Medication is after the disease is already happened. That is in the secondary or tertiary stage of prevention. Next question. Antipsychotic drugs are prescribed to decrease the psychotic symptoms by option A, depressing the central nervous system, option B, inhibiting production of enzymes, monoamine oxidase inhibitor, MOAI. Then option C, blocking the action of dopamine in the brain, and option D, blocking reuptake of norepinephrine and serotonin. Here the right answer will be blocking the action of dopamine in the brain. Here you can see the antipsychotic blocks some of the dopamine receptors in the brain. This reduces the flow of these messages. The rush of the messages, it will be blocked, which can help to reduce the psychotic symptoms. You can see the chart here. Dopamine channel is blocked. Next question. The nurse administers tuberculin test, skin test, and advises the patient to return to clinic for test result in time frame of, what is the time frame of tuberculosis? Option A, 12 to 24 hours. Option B, 24 to 36 hours. Option C is 36 to 48 hours, and option D is 48 to 72 hours. Here the right answer is option D, 48 to 72 hours. The skin test reaction should be read between 48 and 78 hours after the administration for tuberculin test. Next question. In which condition the projectile vomiting is seen? Option A, duodenal atresia. Option B, intussusception. Option C, megacolon. And option D, pyloric stenosis. Here the right option is pyloric stenosis. Projectile vomiting is related with pyloric stenosis. Pyloric stenosis, projectile vomiting. P and P is linked here for memory. Other conditions and symptoms. Intussusception is with the typical feature of current jelly stools. Duodenal atresia is bilious vomitus, like green color vomitus can be seen there. Then megacolon is characterized with constipation. So pyloric stenosis is with projectile vomiting. Next question. In botulism, the most likely mode of infection would be by option A, direct contact with the contaminated soil. Option B, direct contact with respiratory secretion. C, sexual intercourse. And D, ingestion of contaminated food. Here the right answer is botulism is caused by the ingestion of contaminated food. Here you can see botulism is caused by the bacteria Clostridium botulinum, which produces a potent neurotoxin that contaminate food or wounds. This can occur through ingestion of contaminated food or through infection of a wound. Next question. What nutritional deficiency causes goiter? Option A, iodine. Option B, protein. Option C, calcium. Option D, carbohydrate. Here the right answer is option A, iodine. Simple goiter is usually caused by the iodine deficiency. Next question. Which one of the following is example of afferent nerves? Option A, trochlear nerve. Option B, abducens nerve. Option C, vestibulocochlear nerve. Option D, hypoglossal nerve. Right answer here is option C, vestibulocochlear nerve. Here first we have to see what is afferent and what is efferent nerve. Afferent means moving towards, while efferent means moving away. Here the afferent nerves are sensory nerves and efferent nerves are motor nerves. ASEM, that is a short form. Afferent sensory, efferent motor. Now let us see what is sensory and what is motor nerves. Here there is a color code you can see for identifying that green color is for the sensory. There is 3 green colors. Then the blue color is for motor nerves. There is 1, 2, 3, 4, 5 motor nerves, and there is mixed color. That green plus blue mixed color is for mixed nerves. That is 1, 2, 3, 4 nerves. So olfactory, optic and vestibulocochlear 1, 2 and 8 is for sensory nerve. 1, 2, 8 is for sensory nerve. 3, 4, 6, 11, 12 is for motor nerves. And 5, 7, 9, 10 is for mixed nerve. So here you can see sensory, motor and mixed and different color codes. You remember like this. So here the vestibulocochlear is sensory, that is afferent nerve. So the answer here is afferent nerve is vestibulocochlear or nerve number 8. So remember this chart. You have to remember this by your own method. I am giving you the best method like color coding, then arranging in numbers. You have to remember this picture, then these short codes, and even more short codes I have added in the neuro section, that is CNS section. You have to see that videos as well. Next question. Which is the process of assigning specific duties? Option A, coordination. Option B, supervision. Option C, communication. And option D, delegation. This is a simple question, direct question. The answer is option D, delegation. Delegation is the process of distributing and entrusting work to another person. The example is resuscitation, CPR, cardiopulmonary resuscitation. Team leader will delegate roles to the team members. For example, if I am the team leader, I will tell one of you, person 1, to go to the airway and do the airway maneuvers. Option B, I have to tell to go for the blood circulation like IV cannulation and preparing medication. Another person I will tell to go for defibrillation, like that. So this is the delegation, delegating the different role to different person. On the other hand, supervision and coordination is the team leader's other activity, and communication is essential for all process. Next question. Splitting by the client with borderline personality disorder denotes option A primitive defense mechanism in which the client see object as a all good or all bad. Option B, two distinct personalities within the borderline client. Option C, evidence of precocious development. Option D, a brief psychotic episode in which the client loses contact with reality. Here the right answer is option A, primitive defensive mechanism in which the client sees object as all good or all bad. So that is the characteristics. Splitting is two extremities. They will see in extremes. Splitting is a defense mechanism where people think in extremes, viewing others and themselves as all good or all bad. For example, someone viewing their partner as completely perfect and wonderful one moment and then suddenly seeing them as entirely awful and untrustworthy the next day. Maybe most of you experience this, I think. So this is extremism splitting, this defense mechanism. Next question. The cells which functions analogous to fibroblast and constitute the blood-brain barrier is option A, astrocyte, option B, Schwann cells, option C, oligodendrocytes, and option D, ependymal cells. So here we can see the right answer is option A, astrocyte. You can see the type of neurons of CNS. There are 4 types of neurons in CNS. These 4 types of non-excitable glial cells. These are all the glial cells: astrocyte, oligodendrocyte, microglia, and ependymal cells. Astro BBB, oligomyelin, microphago, epen, epi. So this is the short form. Astro BBB, oligomyelin, microphago, epen, epi. So here you see astrocyte is for blood-brain barrier, that is BBB. Star shaped. Astrology is star, right? So astrocytes is star shaped blood-brain barrier. Oligodendrocyte form and maintain the myelin. Oligomyelin. Microglia, this is phagocytes. This is a kind of monocyte or phagocytes in the area of inflammation. This is the phagocytic cells. Phagocytosis is the function. So microphago. Then ependymal cells are the epithelial cells. This is from the epithelial lining of ventricles of brain and spinal cord. Next question. The maternal mortality ratio is expressed in terms of option A, 1000 live birth, option B, 100 live birth, option C, 10,000 live birth, option D, 100,000 live birth. The maternal mortality rate, the right option is option D, 100,000 live birth. Here we can see the definition. Maternal mortality rate is the number of maternal death per 100,000 live birth, but infant mortality rate, IMR, is the number of death per 1000 live birth of children under 1 year of age. So you can see these numbers, remember these numbers for MMR 100,000, for IMR 1000. Next question. The pulsation felt in vagina through lateral vaginal fornix, an early indication of pregnancy, is option A, Jacquemus signs, option B, Goodell sign, option C, Chadwick sign, option D, Osiander sign. The right option here is option D, Osiander sign. Here you can see a memory tip: Jack, Chad, Good Hagar, Osi Palmer. You can see the similarities here. Jacquemus sign is bluish purplish discoloration of vagina. Chadwick is same, another name of Jacquemus sign. So Jacquemus and Chadwick is similar. So Jack is equal to Chad. Jacquemus and Chad is, see the blue color. This is a bluish purplish discoloration of vagina. Now Goodell and Hagar sign you can see. Goodell sign, softening of cervix. Hagar sign, softening in the consistency of uterus. So here both are softening. Here both are, in Jack and Chad, this is both bluish coloration. Here Goodell's and Hagar, it is softening, you can see. So this is Goodell's is softening of cervix and Hagar is softening of consistency of uterus. And here Osiander and Palmer, that is your feeling, felt. Osiander sign, pulsation felt in vagina. Palmer sign, uterine contraction felt during bimanual examination. So like this, you can color code and categorize the things and similarities, and you can remember the signs. Next question. Which drug is preferred in urinary and genital infections? Option A, norfloxacin. Option B, pefloxacin. Option C, ofloxacin. Option D, ciprofloxacin. The right answer here is option D, ciprofloxacin. Ciprofloxacin is the most commonly used drug in urinary tract infections. Next question is, byssinosis is also known as option A, black lung disease, option B, brown lung disease, option C, white lung disease, and option D, gray lung disease. Here again, this question was asked multiple times in the exams. You can see the memory tips to remember. Cotton brown, asbestos white, coal black. This is the memory tip. Cotton brown or brown cotton, asbestos white, white asbestos, black coat. Brown cotton business Monday. So here the term is brown fever. That is byssinosis. Byssinosis is caused by the cotton dust. Monday fever is also byssinosis. So these 4 questions will come from this line. Brown cotton business on Monday. Cold from Andhra. Andhra causes black cold from Andhra. So Andhra causes is caused by the coal dust. That is also called black lung disease. That is the black cold from Andhra. Asbestos white iron residue. So the iron dust will cause siderosis and asbestosis will see white lung disease. Asbestos will cause asbestosis, that is white lung disease. So cotton brown, asbestos white, and coal black. This is the memory tip. And Monday fever and black lung disease, white lung disease, brown lung disease, all those things you have to be remembering. Next question. The lack of oxygen in the tissue is called option A, hypoxemia, option B, anoxia, option C, cyanosis, option D, hypoxia. Here the right answer is option D, hypoxia. You can see the explanation. Hypoxia is the low level of oxygen in the tissues. Hypoxia is in the tissues where the hypoxemia is in the blood. It is the low oxygen in the blood. Anoxia is the total deprivation of, completely deprived of oxygen. Here the low level, but here anoxia, it is completely deprived of oxygen in organ or tissues. Cyanosis is the bluish or purplish discoloration of the skin. This is also related to the poor circulation. So you can see the color coding. Cyanosis blue, anoxia complete lack of oxygen, hypoxemia low oxygen in blood, hypoxia low in tissue. So don't be confused with these terminologies. Next question. The operation for correction of vesicovaginal fistula is option A, Fothergill operation, option B, Latsko operation, option C, Billroth operation, and option D, Fontan operation. Here the right answer is Latsko operation. You can see the different operations here. Latsko is for vesicovaginal fistula. Fothergill operation is for uterine prolapse. Billroth operation, there is Billroth 1 and 2. This is for stomach to duodenum stenosis repair, pylorus repair. Fontan operation is for ventricles of heart. So these are the different operations given in these options. Next question. Which is the basis of ABC analysis in inventory control? Option A, criticality of items. Option B, annual consumption value. Option C, procurement difficulty of items. Options D, unit cost of items. Here, this is a kind of administration related question. The right option is option B, annual consumption value. Here you can see what is ABC analysis. ABC analysis is the method of inventory management that classifies the item into 3 categories based on their annual value. The categories are A, B and C, with A being the highest value and C being the lowest value. Here the options you can see unit cost of price and annual consumption value. So 2 kind of prices you can see, but here the option is annual consumption value because the annual consumption value is the value multiplying unit price by annual demand. That is annual consumption value. This is considered in ABC analysis. Multiplying the unit price by annual demand is the annual value. So this is current level in ABC analysis. Next question. The disease caused by freshwater snail is option A leishmaniasis, option B schistosomiasis, option C leptospirosis, option D toxoplasmosis. Here the disease caused by freshwater snail is, the right option is schistosomiasis. You can see the different vectors and the agents here. Schistosomiasis is by freshwater snail. Leishmaniasis, it is also called as Kala Azar. This is one of the important and repeated question. Kala Azar. This is caused by the sandfly. You can see the picture here. Toxoplasmosis is mainly transmitted from the cat feces. Okay. The leptospirosis is caused or transmitted from the urine of infected animals, rodents or infected animals. Through their urine and through the water it will spread. So schistosomiasis is freshwater snail, leishmaniasis Kala Azar is sandfly, toxoplasmosis related to cat feces, and leptospirosis from the infected animals' urine. Next question. Which is not a therapeutic communication technique? Option A summarizing, option B paraphrasing, option C automatic response, option D reflection. So here some parameters are therapeutic communication parameter and one is not. So this is the negative word, not. So be careful while answering this kind of question. So the right answer here is option C. Automatic response is not a therapeutic communication technique. You can see what all are the therapeutic communication techniques. Active listening, silence, summarizing, ask open questions, paraphrasing, reflecting, making observations, etc. are the therapeutic communication techniques. Respect, time, honesty, patience and compassion is also element of this. So here the automatic reflex is not added. So that is the negative word question. Be careful about that. Next question. An illness caused by myxovirus usually affect the parotid glands and as a complication orchitis may develop is option A mumps, option B measles, option C rubella, option D diphtheria. Here it is caused by myxovirus and affect the parotid gland. That is a clue. The right answer here is option A mumps. You can see the different diseases in the options. Mumps, parotitis, parotid gland. This is also all are kind of paramyxovirus family only, but the different organs you can see and differentiate here. Mumps, parotitis and parotid gland. Measles, the features are complex spots. You can see. This is also one most commonly repeated question. Complex spots are seen in which disease? So measles is related to complex spots. You can see the picture. Rubella is called German measles. This is with mild fever and rash. Diphtheria is affecting the upper respiratory tract and skin. So these all are the different options related to this question. So just go through this all question and answers and memory tips and make necessary notes for your future reference. Thank you all for watching this video and you will continue with the next exam preparation portions. Thank you.